Hello everyone and welcome to Health Talk. I'm your host, Kim Beckett. Well, blood pressure. Blood pressure is a subject that it seems like everybody knows about. You either know someone that suffers from high blood pressure or you have it yourself. Well, it is a constant struggle to keep it under control. And what does high blood pressure really mean to you or to your loved one? Well, here today to give us all of the scoop is Dr. Arthur Glaser. How are you, Dr. Glaser?
I'm great, Kim.
It's very nice to see you, and thank you so much for joining me.
My pleasure.
Let me just tell our viewers a little bit about you. Dr. Arthur Glaser is a board-certified internal medicine physician specializing in nephrology and in private practice here in Vero Beach and on staff at Indian River Medical Center. Let me just start by asking you the question, what exactly is hypertension?
Well, hypertension is high blood pressure. The definitions have changed over the years, but in general, for most people, we would say high blood pressure exists if your blood pressure is greater than 140 over 90.
Okay, and why? Why is it high? What causes us to have high blood pressure?
The estimates are that there are probably 60 million people in this country who have high blood pressure.
Oh my gosh.
95% of those people have no definable reason for having high blood pressure. We call that essential hypertension.
Okay.
5% actually do have a reason, but that's unusual. So for the vast majority of patients that I see in my office, there is no particular reason. We know that blood pressure gets higher as people get older. It usually starts between the ages of 20 and 60.
Wow.
And we'll say that's essential hypertension.
Wow. And so what are some other reasons, the other percentage of patients that they would possibly have high blood pressure?
5% of the patients will have what we call secondary hypertension. They may have underlying kidney disease. They could have an adrenal tumor. There's a very rare tumor called a pheochromocytoma, which causes high blood pressure. But like I say, those are usually unusual causes.
Right. So the majority of patients that come to see you that have hypertension or high blood pressure, it's what you call essential.
Correct.
And it's just that we really don't know why we get it or why we have it.
That's right.
Okay. Because I know my father has just suffered with high blood pressure forever, and my mother has developed it as time has gone on. And so what's going to happen to me? I mean, is that something that kind of runs in families?
It actually does. If you have one or both parents with high blood pressure, you have probably a 30 to 40% chance of developing high blood pressure.
Wow. And are there any warning signs? Like, is there anything for me to look for with this essential hypertension that I should pay attention to?
The vast majority of patients have actually no symptoms at all. I do have some patients in my practice who think they know when their blood pressures are high. But in general, there are no symptoms.
Interesting. And so does it, I have a couple of questions, but so is there any way of telling that you have high blood pressure other than having your blood pressure checked?
No, there are none.
Okay, so that's truly it.
It is.
Okay. And when should, somebody like myself, since we've now talked about the fact that I have both of my parents are suffering from high blood pressure, when should I start looking at this?
Well, when you have an annual exam, you should probably have your blood pressure checked. And I would think at your age, maybe once a year would be more than adequate.
Okay. And then would it just all of a sudden become elevated?
Well, probably not all of a sudden, but probably gradually over time.
Okay. And people that are suffering from hypertension, do we find that it fluctuates throughout the day? Actually,
that's true. Blood pressure tends to rise about 3 or 4 o'clock in the morning. It usually continues to increase up to about noon, and then it starts going down again. And so it actually follows a diurnal pattern.
So what about when you're sleeping at night?
Well, it may be elevated, but I'm not sure there's any reason to wake up and have it checked.
And have it checked. Well, what I find happens, at least in my household with my parents, is that oftentimes my father is on several blood pressure medicines, and so therefore he'll kind of think, well, if he checks it, and even though he's taken his medicine for the day, he thinks that he needs to take some more. How do you feel about that?
I always run into this issue I have some patients who check their blood pressure 10 or 12 times a day.
My dad is one of those.
I think it's excessive. and almost obsessive.
Okay.
And I don't think, and,
I won't let him see this segment then.
and I encourage my patients to check it maybe several times a day, 2 or 3 times a week. But once we reach a baseline, then maybe
Right.
once or twice a week is all that's really necessary.
So how do you really treat it? I mean, if you just find out, like, let's say all of a sudden you were to check my blood pressure and it's elevated and we think that maybe I need to start trying to control it. Can I control it through diet and exercise?
Yeah, there's a number of things that you can do. Activity. I encourage my patients to do some form of cardiovascular activity at least 5 times a week, half an hour of brisk walking or jogging. 5 times, 6 times a week is a good idea. If you're overweight,
I was going to ask that.
if you're overweight, that certainly increases your risk of having high blood pressure. Excessive alcohol consumption. In general, the definition of excessive alcohol consumption is anything more than 2 ounces a day. So if you're drinking more than 2 ounces of alcohol a day, that does contribute to high blood pressure.
Interesting. So how do we go about we can control it through diet and exercise, and then also obviously medicines.
Right. Let me just mention one other thing: salt intake.
Ah.
We eat a huge amount of salt in this country, and salt. Only a certain number of people actually respond to salt as in raising their blood pressure, but we're unable to determine who does and who doesn't respond. So we suggest to all our patients to restrict their salt consumption.
Interesting. So try and decrease the weight, watch the salt.
Watch the alcohol,
Okay.
and exercise.
Okay. Okay. Well, those are great tips, and then also you may decide that you have to follow up with some medicines as well.
Correct.
Okay. All right. Well, Dr. Glaser, thank you so much for all of this terrific information.
You're welcome.
And I hope that you've enjoyed this very informative segment of Health Talk.